Earlier I spoke to Layla McCay from the NHS Confederation. I asked her to explain the different impacts on patients of a deal or a no-deal Brexit.
In the event of a deal, then patients will find not that much difference, especially during the transition period. Healthcare in the UK and the EU will continue pretty much along current lines. In the event of no deal, all of that will stop and new deals will have to be negotiated.
So the government says that it's putting measures in place. If we crash out, how bad is that?
If we crash out, there are risks that there'll be delays to medicines coming in to the UK. There's also risks that people who travel into the EU and want to access healthcare will have to get health insurance or other means of paying for that.
So are you saying lives could be put at risk if we don't have a deal?
If we don't have a deal, then lives could be put at risk, which is why we need to make sure we have contingency plans in place.
At the moment, if we fall ill in EU countries, we use our e-HIC cards to get treatment. How do you see this changing when we leave the EU?
If we were to leave without a deal, then the e-HIC card will no longer be valid. Then the UK will have to negotiate deals with the various countries of the EU so that we can have bilateral access to healthcare in that situation.
So what's your message to the government in this very uncertain time?
The NHS is used to coping with emergencies, but let's not create one. We need good agreements, good plans, good contingency plans in place to make sure that patients' lives are not put at risk, because health is extremely important and patients must be protected from what happens in Brexit.
Layla McCay speaking with me earlier. North Yorkshire